Hello, everyone. Well, cardiovascular diseases are number one cause of death globally, accounting for approximately 18 million deaths all over the world. So we wanted to bring this topic on cardiovascular health with Dr. Louise. She is a naturopathic doctor joining us from Canada live. Welcome, Dr. Louise.
Hi, thank you so much for having me.
Absolutely. It's a very, very important topic. And what want to understand is what are the different diseases that come under the broad terms of what we call cardiovascular diseases?
Yeah, no, that's a great question because it is very, very broad. So, most of us think of cardiovascular disease primarily in the terms of heart attack and stroke, which are definitely very common killers associated with cardiovascular disease. But basically, it means anything related to the heart or the blood vessels. So, that can be things like heart rhythm problems, problems with the structure of your heart or your blood vessels, or if you take it even more broadly, it can include anything that just injures the blood vessels. So that can be things like diabetes, heavy metals, and things like that.
Oh, we didn't realize that diabetes is also part of this. I mean, can you expand on it a bit?
Yeah, so I mean, it's kind of informally part of it in the sense that if you have diabetes, you will inevitably have blood vessel damage and heart disease as a consequence of that. So a lot of the times it's kind of um, as disease progress, they affect the cardiovascular system, and so you end up developing a lot of these issues. So if controlled, it's not a cardiovascular disease, and if left uncontrolled, it can become part of the picture.
Hmm. So, but let's talk a little bit about the causes for cardiovascular diseases then.
Yeah, so sometimes it is very much out of your control. So those would be things that develop at birth. So that'll be things like, holes in the heart, problems with your valves structurally, or you are just genetically kind of at a disadvantage. But most of the time, it is a product of lifestyle. In fact, cardiovascular disease is considered to be 80% preventable. So it's a matter of all of the different things we do that put strain on our heart and damage our blood vessels. So that can be things that we're eating. So high blood sugars is definitely the number one cause of that. But sometimes we have things like pesticides and heavy metals that sneak their way into our consumed products like food and water. Or it can be high stress, like our blood vessels respond to our nervous system. So if we are in a chronic stress state, then it's going to be really hard on our heart and our blood vessels and eventually lead to some damage. It's very broad, to be honest. There's a lot.
Mhm. What is surprising to me is that something that's 80% preventable is accounting for number one death in the whole world,
Yeah,
right?
I know. That's why I kind of got into this industry. The two facts to me don't add up. And I think a lot of it is just this lack of understanding and lack of knowing what to do to prevent these sort of things. One of the biggest issues with cardiovascular disease by far is the fact that it's kind of considered the silent killer, which essentially means a lot can be happening in the background and you don't really know it because it's not an overt symptom. So it's not like spraining your ankle where it's screaming at you and and you pay attention to that area. A lot of the times it's these really subtle, small changes over a long period of time, and they just go undiagnosed and overlooked for a really long time. And by the time you're exhibiting symptoms like chest pain, which is the most classic cardiovascular symptom, a lot of the times your arteries and things like that are already 90% plugged, essentially. So you don't really get symptoms until it's very, very far along. So that's why I'm trying to spread more of the knowledge on getting on top of these things earlier and kind of taking care before you get to that stage.
So, are there some kind of a testing that people can do after a certain age that can at least talk about, at least warn us, right, if there's any plaque happening in the arteries.
Yeah, absolutely. There is like one of my favorite tests that I like to run is called the pulse test. And basically, what it assesses is how stable the plaque in your arteries is. And so, plaque in of itself is inevitable. We all have plaque in our arteries, and it's actually just the type of plaque that's really unstable that leads to things like clots that will go on to cause heart attacks and strokes. So we have blood tests that can measure how unstable your plaque is. Have tests to measure inflammation and blood sugars and nutrient statuses and whether or not you have heavy metals. There's a whole variety of functional blood tests, especially that you can screen someone. And then, of course, there's the classical tests like a stress test where you're on a treadmill or MRIs and ultrasounds of the heart and things like that. But those become a little more reserved for severe cases. So anyone who's like more on the prevention side of things or early stages of cardiovascular disease, it's usually some form of blood test and physical exam that's required to kind of check you out.
Sure. So onset of these cardiovascular diseases, does it happen like after a certain age group, like 40 something or 50 something?
Yeah, like age is in of itself a risk factor. So definitely the longer you've lived on this earth, the longer you have time to build up this damage to our blood vessel wall, especially if you're doing some things that you maybe shouldn't be doing. So yeah, it's definitely more common in older populations like 50 and onwards, but we're seeing more and more of young people having the consequences of heart disease. And I think that's really telling in of itself.
Yeah, definitely. So what can we do?
I mean, I think the best thing you can do is go see a healthcare provider to get individual risk looked at because cardiovascular disease can come from so many different places. So it's really hard to give generic recommendations. But of course, there are the staples like eating nice, clean food. So trying to avoid all of those nasty chemicals that will damage the blood vessel walls. Try not to eat high sugar foods because those can lead to things like diabetes, which is one of the absolute worst things for your blood vessels. Stress management is a big one that we all can work on. And there's also devices you can use now to measure your stress response. So those will be those handy watches or things like an Aura ring that will measure heart rate variability and tell you how well your nervous system is functioning. Sleep, lots and lots of sleep, good quality sleep. So deep, nourishing sleep, not just the type that's medication induced, which often doesn't provide you the healing type of sleep. It just kind of knocks you out. Breathing, getting oxygen to where it needs to go, and movement. Exercise is definitely one of the best things you can do for your heart, but within reason, because over-exercising is very damaging. So that's when you get those marathon runners who are dying at the age of 50 from a heart attack, and it's taking exercise too far. So like anything in life, you can go to excess, but generally speaking, most of us are needing to move more in our lives.
Sure. So you talked about the prevention part of it, right? The 80% can be preventable. So all these things combined, what you're talking about, diet, exercise, all that would be combined, sleep, stress, so many elements you talked about. Any particular type of diet, I do want to touch upon that. There's a lot of research that talks about Mediterranean diet versus Ornish diet or DASH diet. Any thoughts on any particular type of diet that we should follow?
Yeah, I think they all have their purpose in specific populations. So, for example, the DASH diet is typically considered a really good diet for people with high blood pressure. And it has some good foundational tactics to it, like including lots of fresh vegetables and things like that. There's the portfolio diet, which is really more helpful in high cholesterol patients. The Mediterranean diet is generally touted as the best out of all of them, as more of a generic diet to follow. And I think the big reason for that is because of the high quality olive oil that is generally considered a part of that diet. Olive oil in of itself, if it's the good, true, organic, high quality stuff, is actually very stabilizing to the plaque in our arteries. So I suspect that might be a part of why the Mediterranean diet has such good research associated with it. So I guess that's my long way of saying they all can have very good impact. It's just a matter of pairing the right diet with the right person. So if you have high cholesterol, then maybe the portfolio diet would be something you want to focus more on versus someone who has high blood sugar, for example.
I see. And what are your thoughts on oil first, type of oil?
Yeah, like oils are a huge topic right now, mainly because there's such a drastic difference between the quality of our oils. So, those poor quality canola oils and things like that they're coming out with more and more research to suggest that this is not what we want to be focusing on. In the past, they've really given a lot of bad media to things like animal-based fat. And I mean, to a certain extent, that does have truth, but then there's always the quality picture of that. Like, is it the grass-fed type? Or is it coming from an animal that in of itself has a bad environment, a bad diet, and all of those hormones and things like that that are given to the animal are getting stored in their fats. So if you give that type of, butter to someone, then they're, it's a potential exposure of more things. And so, yeah, focusing on high quality fats and then taking care of your oils. So refrigerating them so they don't go rancid, because they're very fragile to things like sunlight and heat. So taking care of the oils that you do have, going out of your way to make sure that you're getting oils that come from the good sources. So olive oil is always going to be one of those high sources of good fats due to the oleic acid. And then there's always the omega-3s, which can be found in fish, but also in a lot of plant-based sources like algae is probably the best source of direct EPA and DHA, whereas some of the other plant-based oils get omega-3s in a less direct way. Yeah, so there's a big difference between good and bad fats. And I think just saying fat or oil in general is good or bad, it's way too simple. It's like a very oversimplified view. That's why focusing on like just protein or just fat or just carbohydrates, it gets a little bit of a heated debate because people are trying to make broad statements, whereas it really matters on the quality within all of these categories and where you're getting these sources from and how much of it you're eating. And yeah.
Well, there's a lot of information out there which is misleading also, and that's the problem, right?
Absolutely, I agree.
Anyone has any questions? I see quite a few people dialed in. If you have any questions, you can ask live or later on as well. We are ready to wrap up this session. What would you like to summarize?
I guess my takeaway that I'd like a lot of people to kind of get from this is that it's never too early to start focusing on your heart health, tuning into your body and how it's functioning, and just really prioritizing living your best life. Because I think a lot of us put off our health until there's a crisis, or we think that we're too young to have to worry about things. But the sooner you get on top of things, the less likely there is the chance that you're going to have to go through these major health crises. And that goes well beyond cardiovascular disease. That bleeds into cancer and just quality of life, mobility, aging gracefully. So get started early if you can help it. Don't wait until you're suffering greatly to see a healthcare provider, and then just seek healthcare that makes sense to you.
Mhm.
And just find yourself a doctor that you trust and you like.
Absolutely. Well, thank you so much, Dr. Lewis, for being with us. We have been talking about cardiovascular diseases, big topic. We just wanted to give a sneak peek on what you can do to embark on a journey to start taking care of yourself. That's the intention, and introduce you, if you don't take care of yourself, what can happen to your point, right?
Yeah, definitely.
With that, thank you so much, everyone. And thank you, Dr. Lewis, for being with us. And if any questions, comments, feedbacks, we are always there every single day trying to give you a teeny bit of advice, natural therapies every single day. Thank you and have a great day, everyone. Bye-bye.
Bye.